Hello, and welcome to Science on the 7th, our platform where we talk about issues related to air quality and health. I'm really excited today because we are recording this at the HEI annual conference. We are in Austin, Texas, and for the last 2 days, we've been hearing a lot about the latest science on health effects of air pollution, the latest methods to measure exposures, and so much more. And today I am absolutely honored to be talking to Dr. Doug Dockery, who is at the conference and spoke with all of us yesterday about the several decades of science on air pollution and its impacts on health. For those of you who don't know Doug, he is one of the people you need to know about in the air pollution epidemiology space. He was one of the epidemiologists leading the Harvard 6 City studies that we're going to talk all about. He's been a professor at Harvard for many, many decades and has also collaborated on a number of projects. Most recently, he and another titan from the field, Dr. Arden Pope, wrote this book, Particles of Truth. So we'll talk a little bit about the book. So, Doug, without further ado, welcome and thank you so much for taking the time to be with us today.
Thank you. It's been really terrific to be here at the conference. It's always an exciting place to be.
It's an absolute honor because, of course, when I started studying air pollution, the 6 City study was one of the first things we learned about. So, going from when you started to now, it's been several decades. And if there were three things that you really wanted people to know about health effects of air pollution, what might that be? Let's start with that really broad question.
Okay, give me pause here. What? So, three things I'd like people to know about air pollution. So the first thing I'd like people to know is that we've been making tremendous progress in terms of cleaning up the air, and over the 5 decades that I've been working in this, we've seen tremendous improvements. And the good news is we can do something about air pollution. We can do something about improving people's health. And we've focused a lot on demonstrating what the adverse effects of air pollution have been. But we've now been able to show that where we've cleaned up air pollution, it's been leading to measurable improvements in people's health. So we have documentation that really shows all our efforts have had positive influences on not only the air, but also on people's health, both for children and for adults and even for the elderly people. So beyond that, I'm not sure if I have two other items.
I think that's a pretty powerful message and a really important one, especially right now when we see a lot of headlines of air pollution is responsible for so many deaths and economic impacts. Knowing that we have the evidence and the documentation that shows the improvements and the resulting benefits to air quality and health, I will take that message. I think it's a really good one. So going back in time a little bit, the Harvard 6 City studies, as I said, one of the first things you read about as a student, one of the things that is sort of the cornerstones, seminal contribution. But can you tell us a little bit about how the study originated? What was the plan? What was the thinking? What went into it? And what did you find that surprised you in the 6 City study?
Well, a lot of things surprised us. The study started in the early 70s, actually in about 1974. And at that time, we actually had the Arab oil embargo. And for people who remember that, the Arab countries had limited exports of oil to the United States, and suddenly there were perceived shortages, and people were stockpiling gasoline in their cars. There were long lines in front of the gas stations. There was a general panic about the oil supplies. But thinking about this, what the real concern was thinking about where we were going to get our power from.
Right.
So most of the power plants in the US were burning imported oil, and there was concern that this would not only impact automobile traffic, but more importantly, supplies of electricity. And so there was a expectation that we'd be moving from imported oil to domestic sources of fuel. And our biggest source of fuel at that time, and still is, would be coal. And so the expectation was that we would be switching many of these power plants to coal, which was much dirtier and potentially leading to higher air pollution levels, particularly on the East Coast, downwind from the major oil burning power plants in the Midwest. And the National Institute of Environmental Health Sciences, and David Rawl in particular, saw a need to establish a prospective study to monitor what happened to people's health in this expected transition. And he put out a call for applications for proposals, and Ben Ferris and Frank Spicer and Jack Spengler put in a proposal to study respiratory health prospectively in a sample of children and adults in 6 communities across the United States that were selected to represent the range of exposures to air pollution at that time, and also expected to experience changes in air quality, either improving or getting worse over the next decade. And so we went into the field and started collecting pulmonary function data, respiratory symptoms, characteristics of their respiratory health in school children and adults, and coming back every year and following them up to monitor that. So the expectation was that this would be a respiratory problem, and that we could see changes in growth of lung function in children, and actually the decline of lung function in adults. And I mean, we did observe that over the years. We could see associations with those measures, those clinical measures we were doing, but it did not. They were not large. I mean, a 10, 15% change in lung function, which was measurable, but in terms of clinical significance, it's not something you would recognize as an individual. So, I mean, the study was successful in that sense, but at the same time, there was evidence developing that on days when air pollution was higher, you could see increased numbers of deaths in different communities. And Joel Schwartz actually had come up from EPA to do a sabbatical with us, and he had analyzed data in London showing these associations, and he asked, could we do something like that in the United States? And we had detailed data in Steubenville, Ohio, so we attempted this regression analysis between daily mortality and air pollution, particle air pollution in Steubenville, and saw the same things they were observing in London. We searched around for other communities. The problem was that at that time, the standard was that you would measure particulate air pollution every 6th day. So basically 1 day a week. So it's hard to see daily effects when you only measure it basically 1 day a week. But we found in Philadelphia they had daily measurements, and in fact reproduced the analysis there, and were very, very easily showed that daily mortality in Philadelphia also went up with total suspended particulate levels. So this raised the question, well, what happens if you're exposed day after day after day? And so in following up our population, we said, well, of course, we monitored when people
Mm-hmm.
died
Right.
as part of the follow-up. And so we looked at those, gathered those data, and actually Arden Pope had come to do a sabbatical with us at that time, and we gave him those data and said, okay, do a survival analysis
Mm-hmm.
and help us understand what the effect is on advancing the date of death
Mm-hmm.
related to air pollution. And he came back and very quickly showed that, in fact, in the cities that had higher pollution, people were dying earlier, and in fact,
Mm-hmm.
dying 2 or 3 years earlier than the clean cities.
Mm-hmm.
And that was actually a shock to us. It was a
Right.
very big effect, much bigger than we ever expected, and unanticipated.
Mm-hmm.
And as we were uncomfortable with that, we did not feel that we could really publish that unless we verified it
Mm-hmm.
somehow. So we went thinking, well, what do you do? We're not going to try and reproduce the Six Cities study in another
Mm-hmm.
cohort, but we thought, are there other places, other
Mm-hmm.
cohorts where people are being followed? And we knew of the American Cancer Society had been
Mm-hmm.
conducting a study to look at the causes of cancer,
Mm-hmm.
had a massive cohort across the United States. We approached them and asked, could we match air pollution data to your records on mortality,
Mm-hmm.
which they had also been collecting? And they eventually agreed, and we actually had the Arden that had to go down to Atlanta to
Mm-hmm.
um, work on their computers to maintain the confidentiality of the
Right.
data down there. But uh, he came back and found the same results that we had seen in the Six Cities study.
Interesting.
So that was confirmation. And at that point, in fact, we submitted both of those papers to journals, and they became very, very important in identifying the importance of actually PM 2.5. This is the
Mm-hmm.
first PM 2.5 measurements
Right.
and the first studies looking at PM 2.5. And then that became the basis for setting the standard for PM 2.5 in 1997. I mean, the other major surprise to us was, as I said, we were thinking this was largely a respiratory problem.
Mm-hmm.
But when we started looking at the deaths, what we found was people were not dying early because of respiratory problems.
Mm-hmm.
They were dying from cardiovascular issues.
Right.
And it made us think there's a different pathway here, a different
Mm-hmm.
mechanism. And so we started designing studies to evaluate the cardiovascular effects and trying to understand the mechanisms there. And in fact, the American Cancer Society study was particularly important in that because they had much bigger data sets, but also had more detail on the
Mm-hmm.
causes of death that we were able to examine. And it led to a whole series of studies, some of them funded by the HEI,
Mm-hmm.
to look specifically at cardiovascular pathways.
Yeah, and it's actually fascinating that started with a question during the embargo,
Mm-hmm.
and then led to such a transformative discovery, which then led to so many decades of science and regulation and policy. Very, very impressive. I think today, if you look back at how the evolution of the field has happened, the kinds of questions we are now asking about air pollution and health, what does what do you think are the questions moving forward? We know now that air pollution impacts health, impacts various organ systems.
Mm-hmm.
There's now the World Heart Federation talking about air pollution as a risk factor. There is recognition generally that air pollution impacts our health. So where do we go from here? What questions do we still need answers to?
Well, I mean, when you think about the Six City study or the American Cancer Society study, those were using very broad definitions of exposure.
Mm-hmm.
They were average concentrations in the six cities were reasonably small communities, but for the American Cancer Society, it was the whole metropolitan area. We only had one monitor in there, and as we've gotten more and more sophisticated, we've gotten honing down more
Mm-hmm.
specifically on smaller and smaller areas, getting closer and closer to identifying individual exposures.
Mm-hmm.
And that's led to much, much improved estimates of the
Mm-hmm.
effects of air pollution. And so, now we're trying to get down to the point of understanding in the neighborhood or in the microenvironments
Mm-hmm.
and, proximity to roads and bringing this down to the community level, but also, the individual level and trying to
Mm-hmm.
understand that. And so that raises a lot of questions about other things that are going on simultaneously.
Right.
I mean, clearly, air pollution, we've been focusing on that, but for the same reasons that we're exposed to air pollution by where we live, where we
Mm-hmm.
work, where we go to school, where we recreate, those areas are also affected by a lot of other characteristics of greenness or noise or access to food,
Mm-hmm.
and trying to initially it was trying to understand whether those might be alternative explanations,
Mm-hmm.
but also thinking about, well, how do all those factors work together? And when thinking about the environment more broadly, it's not just air pollution.
Mm-hmm.
And it's not just a single air pollutant, the PM 2.5. It's
Absolutely.
multiple pollutants. It's multiple characteristics,
Mm-hmm.
the temperature, the weather,
Mm-hmm.
the noise levels, but it's also the availability of healthcare, the
Mm-hmm.
availability of uh, good food,
Mm-hmm.
where being the greenness, being able to experience the
Mm-hmm.
outdoors. And I think we've been broadening our definition of what exposures are. And the challenge is how you um, bring all these different
Right.
exposures together to really understand the full context for an
Mm-hmm.
individual. And then, identifying where there are opportunities for interventions.
Mm-hmm.
And uh, as has been pointed out by actually many of the speakers here at the meeting, I mean, it's not telling somebody you're having problems because you don't eat well, or
Mm-hmm.
you need to exercise more, or you need to do this. I mean, it's how do we change the environment and
Mm-hmm.
not put the responsibility on the individual, but
Individual.
think of these as community interventions
Mm-hmm.
that really have a public health benefit.
Right. Right. No, that's very true, and I think the other thing that we've heard and sort of learned more about is also there are more ways now for us to look at these data in a more comprehensive
Mm-hmm.
manner. I think of the study that you led, and more recent studies from Harvard University, including Francesca Dominici's study, millions of people's, millions of health data points that could be utilized. So there's definitely, more work to be done. But since we are at the HEI conference, I also wanted to, speak for a minute about your interaction and sort of work with HEI. You just before we started recording, you mentioned you were at one of the HEI conferences 30 years ago. And one of the pieces that, of course, HEI was very involved with was the reanalysis studies, essentially taking another look at the
Mm-hmm.
data. So, can you tell us a little bit more about the reanalysis work? Again, like what was the genesis of it? Because it was a very interesting genesis, and then, how you view the work that evolved out of it.
So, as I said, well, initially, um, the Philadelphia paper got a lot of interest. Whenever you have a scientific study that really challenges the existing paradigm, I mean, you expect there to be pushback and, hopefully through the regular scientific process, there would be people trying to replicate that, trying to evaluate that. And in fact, there were groups that looked at the same data from Philadelphia and said, well, we don't get the same results. We don't find the same associations with particles. We think it's something else. It might be weather. It might be sulfur dioxide instead of particles. And so there was a lot of debate in the scientific literature about this. And normally, I mean, you would expect this to resolve itself over a period of time, that there'd be back and forth and papers published and letters to the editor written and commentaries and so forth. The problem here is that when this gets in the setting of policymaking, then this whole process is accelerated, and there is a need to resolve these legitimate conflicts very quickly.
Right.
And so in this case, HEI stepped forward and initiated what was called the Particle Epidemiology Evaluation Project to look at these data. I mean, after all, time series analysis and the whole approach was new. It's well established in other fields, but we were bringing this into environmental epidemiology. And so to consider all the alternative explanations and the analytic methods and the quality of the data and so forth. So they had a international search for a reanalysis team and identified a team at Johns Hopkins and charged them with taking the data and reanalyzing and coming up to evaluating whether this was a real association or just some kind of spurious statistical analysis. So John Salmon, Scott Seeger, and actually Francesca then became involved with this. Kira Spirhane was instrumental. I reanalyzed these data and actually very quickly showed that the associations, at least in Philadelphia, seemed to be real and not spurious, and actually did some terrific work developing the technologies and making new analytic methods generally available to other investigators. So that was a very successful application of this reanalysis principle by HEI. In 1997, when the EPA published or promulgated the PM 2.5 standard, there was a lot of pushback from that and demands to, well, we need to do the same thing for the 6-city study and the American Cancer Society study. And it became demands to see the raw data, the individual data for participants in the study. We could not release the raw data because when we recruited people into the study, we said, if you tell us your data, I mean, your characteristics, your medical history and so forth, we will use that, but we will not reveal that to people outside of the study, much less make it public. So we were in a quandary about how to respond to demands to look at the original data, to reanalyze it, and actually based on the example we had from the previous reanalysis of the acute studies, we approached HEI, Dan Greenbaum and Bob O'Keefe at that time, and said we would turn over our data to you under the condition that you have to maintain the confidentiality of the individuals. And then you can have an independent team reanalyze the data, do whatever with the data. And so we came to an agreement, and both Harvard and the American Cancer Society, and they formed a committee, an expert committee to oversight this. They put out a call for and a reanalysis team. They had many applications, but ultimately selected a team from the University of Ottawa under Dan Krusky, and they, after initiated this review. Actually, it was very quickly. It started in 1997, and we briefed them on the data, on all the methods, and so forth. But then basically turned it over to them, and they had public meetings where they discussed, invited people to come and talk about what they felt were the weaknesses of the studies. And then they developed a research plan, and they shared the research plan with us. But then once that was approved by the oversight committee, then they went off and did their own work. They came in, looked at our original records, but then we basically saw nothing for 2 years while they did their own reanalysis. And then in July, actually it was July 26th of 2000, a day I remember well, we went to a press conference called by HEI where they were going to present the results. And it was the first time we actually were seeing the results. And they announced that they were able to show that the data was of good quality, that they were able to replicate the original results, and that they could not find, they also showed that the results were not modified, could not be explained by other factors that they also looked into. So it was a great relief to us. And at that time, they released the full report, which was 303 pages, including the 14 pages, which were our original documents. And so it was anyway, that it turned out to be a major effort to at least replicate those original findings. I mean, the problem with it is, though, I mean, that's if you're just reanalyzing the same data, hopefully you would get the same result. And that really doesn't validate this. I mean, we need verification from other investigators in other places and with other groups of people. And what has happened since then is one of the major insights from the American Cancer Society study was you did not have to do a standalone epidemiologic study like the 6-city study. You could just take an existing medical cohort that was being evaluated for some other reason and add in the air pollution data and replicate and understand what the effects were of air pollution. So that opened up this opportunity for many other studies to evaluate this. And it's been replicated now in 10 or so additional studies since 1997. And the data is very, very strong right now. I think there was a lesson that it needed to be done, but I don't think it's not something that we would do again. It's not a good use of resources. Although it was, I mean, we have to say that the work led to some really important insights into, they were able to dive much deeper into the data, and they provided new methods and has really advanced the science very dramatically, particularly in continued analyses and extensions that HEI funded through the University of Ottawa to
Mm.
uh, do additional analyses of the American Cancer Society study and
Yeah.
additional follow-ups. And it's really been very positive in that respect in developing capacity
Mm-hmm.
uh, and developing the analytic methods and developing our new approaches to look at these data.
Yeah. Yeah, and as you were sort of walking through this process, what I was also thinking is that science is so dynamic. Like, in every step of what we're doing, we're also learning and adjusting and making refinements. So there's a lot of people out there who are currently entering the field. They're
Mhm.
starting to think about air pollution as a place where they want to be, and someone as experienced as you are, what would be your advice to them? What should they be thinking about? What should they keep in mind? What is helpful to know? Especially because science is dynamic, but sometimes it's also frustrating. Long hours trying to figure out the answer. So, what would be your advice to them?
Well, I think when you look back on this experience, and as we did in writing this book, I mean, you think in some sense that there's this direct path, for example, from the Six City study starting in 1977, 75, 74 rather, to where we are here today. But that's really not the case. It's not. There are a lot of turns, twists and turns in the process. There are a lot of false leads, a lot of wrong places you turn. And I mean, it's very important to be critical of the science. I mean, that's the way our science advances, by
Mm-hmm.
disproving hypotheses, not by confirming these. And so you have to be critical, and probably you should be most critical of your own work and really question it.
Mm-hmm.
And so I think in writing the book, what we wanted to do was show we have all the papers there. And so, I mean, you can go and read the Six Cities paper, you can read the American Cancer Society paper, but, what is missing is, you know, these stories
Yep.
about how we got there. And more importantly, the stories about, what did not work, about
Yes.
the things that,
Mm-hmm.
you don't publish.
Yep.
Uh,
Yep.
I mean, you would hope that those also get published, but
Mm-hmm.
it generally there's a bias to only publish the positive results. But there are many, many um, false leads and uh, questions that are raised, and how you deal with those, how you deal with to be expected to expect to receive criticism, and in fact, that's part of the process.
Yeah.
And as I said, we try and be most critical of ourselves in this
Mm-hmm.
goal. I mean, for example, with the original findings with the mortality in the Six City study, as I said, we did not believe it. We had to confirm that
Mm-hmm.
before we would submit that for publication. And um, it's understanding those, they're going to be false leads, and
Mm-hmm.
uh, being able to take criticism and grow from that is
Mm-hmm.
the important point.
Yeah, and that's, so profound also because that's such an important life
Mhm.
lesson. And I've been reading the book very quickly in the last couple of days, and I think it gives such a useful perspective to what we knew
Mhm.
about the Six City study. We know what the data were, what the methods were, what the findings were, but having the opportunity to take a peek behind the scenes of how it evolved, what challenges came up has been fascinating. So
Mhm.
thank you to you, and also to Arden for writing the book. And also, thank you so very much for being with us today and taking the time to chat. I wish we could go on for another, 2, 3, 4 hours and ask you so many more questions, but hopefully we'll get some of them answered in the book and some of them answered in other conversations with you. So thank you very much, Doug. This has been highly informative, very fascinating, and I think I'm taking away this notion that you started with, that we know that action on air pollution brings benefits, and that's the thing we need to hold on to and keep making progress towards. So thanks a lot, and thank you to everyone who's listening. We hope that you'll also check out the book, and we'll be back in June with another episode. Thank you very much, and goodbye.